For example, there are no cancer risks associated with this medication whatsoever. I bring that up because once there was a discussion around a very rare thyroid cancer, bad news for mice, which they may be at risk of when taking a GLP-1 analog, but we've not seen a single signal of either thyroid cancer risk in humans. In fact, the experts in this field would kind of wish that that wasn't in the monograph where they talk about the risk in mice of this rare thyroid cancer. It kind of spooks people, and we don't see it. Not only do we not see cancer risks with this medication, but in fact, what we do see, that if someone loses 15, 20 or more percent of their body weight, there's a dramatic reduction in the risk of cancer almost across the board. And so the FDA says, because of really good science, clinical trials called SUSTAIN-6 and the LEADER trial, it says that they have every reason to believe, and they'll actually allow a claim, that just being on these medications, if you're at risk of heart disease and you have diabetes, just being on the class of GLP-1 means that you will experience a reduction in your risk of heart disease and a reduction in your risk of stroke. And that those changes are independent of weight loss and they're independent of how the medication's helping with your blood sugar. So there's something else going on. That's kind of really cool. And by the way, and I know this is really close to you, Sean, but also the semaglutide, interestingly enough, is in a phase 3 trial right now because it's been shown to be quite effective in reducing the progression of dementia in those who are living with varied dementia disorders. So there's something about keeping vessels open, whether in the heart or in the brain, that this medication does. It's kind of really, stay tuned on that. And so for that reason, we kind of have this really interesting and positive kind of safety realm to the GLP-1 class of medications. Keep in mind also, it's in a way, it's a natural hormone. It's not really a medication. It's 94% identical to something you make yourself. The most common side effects are mild nausea and mild heartburn. It's a once weekly medication. So if you have side effects, it's most likely around the day that you take it, kind of in the week. And the medication's side effects become less and less over time. It's something about us getting used to a higher level of GLP-1 in our body that results in over time, a reduction in side effects. And it's very rare later on in using this medication that side effects are persistent. Maybe in 5% of people we'll see a persistent mild nausea with the use of medication, but most people will say, yeah, the effect is there. It's supporting my appetite, diminishing my wanting, my desire, my drive at the couch while watching TV. But side effects are pretty well gone. Yeah, safety and tolerability, that's another word for side effects in a way. That's something which we review with all patients for sure.